this video, we'll discuss about calcifying epithelial odontogenic tumor. So the definition is it is a locally aggressive tumor that consists of strands and sheets of polyhedral cells in fibrous stroma with no inflammatory component and is accompanied by spherical calcifications and amyloid-like materials. Spherical calcifications and amyloid-like material. Now, a very important thing to remember here is that its etiology. It arises from the stratum intermedium. There. It can also arise from the remnants of dental lamina found in initial stage of odontogenesis. Now coming on to the epidemiology, it is usually seen in middle age, so basically 40 years. Then it is more in males than in females. Also, in sight, it is more in mandible than in maxilla. In mandible, it is more in the molar region than in the premolar region. Now, coming on to the clinical presentation. So, before we come on to the clinical presentation, remember there are two types. One is the central and one is the peripheral. So, the peripheral basically it lies in the anterior part, okay, and it is present as a soft tissue swelling. Okay, now coming on to the clinical presentation. So this is asymptomatic, and it also is always or oftenly associated with an impacted tooth or unerupted tooth. Then in sign, it goes under cortical expansion and distortion. Then coming on to the radiographic features. The radiographic features are very characteristic, but there is also considerable variation. So first of all, what we see is it contains irregular masses, irregular unilocular or multilocular radiolucent area, which further has radio opaque scattered foci. Now, this often gives a appearance which is called as driven snow appearance. Okay, this is the key word that you need to remember for calcifying epithelial odontogenic tumor, which is also called as Pindborg's tumor. Now, there is also one more thing, that it causes the expansion of buccal and lingual cortical bony plates. Now, if we do the MRI in T1 weighted images, we will see that there is an hypo-intense lesion, and in T2 we will see that there is mixed appearance. So, mixed, hyper-intense and hypo-intense. Now, coming on to the histopathology. Now, in histopathology, as I mentioned in the definition, there will be closely packed polyhedral cells in non-inflammatory stroma. Also, there will be homogeneous hyaline materials which will resemble the tumor cell, so amyloid material is also present. Then there will be oval shaped nuclei with an homogeneous eosinophilic cytoplasm. Now, a very characteristic thing to remember is it has Lees-Gyang rings. Now, these are basically rings which are in tree ring pattern. So, this is because of the presence of several calcified masses around the tumor cells. Okay. Now, if I have to draw the diagram histopathologically for Pindborg's tumor. I will draw it. First, we will draw certain polyhedral cells. Alright, and certain stroma. Now we'll take the purple color and we'll draw the oval nuclei. Then we'll draw the homogeneous eosinophilic cytoplasm. Now coming on to the labeling. First of all, what is this? This is polyhedral epithelium cells arranged in sheets. These are the leaf gang rings, and this is the fibrous stroma. Now coming on to the treatment. In treatment, the thing that you need to remember is that it recurs. So, but it is a less aggressive lesion. We will do local resection. Plus, we will do surrounding rim removal. Now 50% it recurs. Also, we can give some radiotherapy, uh, but overall prognosis is good. So this completes the calcifying epithelial odontogenic tumor.